The squiggles and lines of an electrocardiogram, or ECG, may resemble a mountain range to the untrained eye, but to medical professionals they are a treasure trove of information about the heart's electrical activity. Among these, ST segment changes and T-wave abnormalities stand out as crucial indicators of cardiac health. The ST segment follows the heart's electrical sprint, the QRS complex, and is the calm before the storm of the T-wave. When this segment hikes upwards, known as ST segment elevation, it's a red flag for a heart attack or ongoing injury to the heart muscle. Conversely, a downward trek or ST segment depression can signal myocardial ischemia, a condition where the heart muscle is starved of oxygen, often a precursor to coronary artery disease. Horizontal or downsloping ST segment changes are particularly telling, often pointing more specifically to myocardial ischemia. And then there's the J-point depression, a dip at the junction where the QRS complex meets the ST segment, hinting at subendocardial ischemia, a condition affecting the inner layers of the heart wall. The T-wave, typically a gentle hill following the ST segment valley, can also reveal secrets about the heart's condition. When inverted, the T-wave becomes a valley in itself, indicating possible myocardial ischemia, infarction, or even an enlarged heart muscle. This inversion may linger long after an ischemic event, serving as a haunting reminder of the heart's past struggles. Flattening of the T-wave, where its usual peak becomes a plateau, can be a sign of myocardial ischemia or even non-cardiac issues like medication effects or central nervous system disorders. On the other end of the spectrum, peaking T-waves towering above their neighbors may point to hyperkalemia or acute coronary syndromes. Biphasic T-waves with their dual positive and negative components are the chameleons of the ECG, appearing in various conditions from ischemia to the effects of certain medications. Interpreting these ECG findings is like piecing together a puzzle, requiring a deep understanding of the patient's clinical context, including symptoms, risk factors, and other diagnostic results. Recognizing these changes is not just an academic exercise. It's a critical step in diagnosing and managing cardiac conditions, guiding life-saving medical interventions. Remember, these signals on an ECG are more than just lines on paper. They are the heart's cry for attention. Any significant or concerning findings should be evaluated by a healthcare professional without delay, for they hold the key to preventing, diagnosing, and treating heart disease.